Did you know that pirates go on vacation? I didn't, but it makes sense. All of us need a change of scenery. Whether it's going on vacation or just leaving the library for a few minutes for a breath of fresh air, everyone deserves time to relax. Now sit back and enjoy this quick image on pyruvate kinase deficiency. For a pirate with a life on the high seas, the best change of scenery is to go where water's nowhere in sight, the desert. And you want to know what pirates love to do in the desert? Kiteboarding. See that pirate kite? Yep, of course the kite is decorated in pirate style. By the way, the kite here is Pixarize's recurring symbol for kinase enzymes, since kite sounds a lot like kinase. And the pirate here? Well, that's none other than Pyruvate. It's the Pyruvate pirate. Get it? Putting this together, this pirate kite should remind you of pyruvate kinase. Next, notice the board on wheels our pirate is riding to kiteboard. You might even say that she's standing on a small auto. Wait a minute, a small auto? Isn't that Pixarize's recurring symbol for autosomal recessive inheritance? You see, at Pixarize, we use large dominant autos, like trucks and tanks, to symbolize autosomal dominance inheritance. On the other hand, autosomal recessive inheritance is represented by small recessive automobiles, like this board. Anyway, the tiny kiteboard on wheels should help you remember the inheritance pattern of pyruvate kinase deficiency, which, as you already know, is autosomal recessive. But this pirate's kiteboard is having a lot of trouble. Yeah, she totally just crashed into this big desert pig, which we'll get back to in a minute. But first, notice how her kiteboard isn't just wind powered, it's also battery powered. And that battery in the back has been totally messed up in the crash. By the way, this smoking battery also reminds me of depletion of ATP, kind of like that seen in pyruvate kinase deficiency. You know, since ATP is basically just the battery of the cell. Without this enzyme, cells quickly run out of ATP, and hence have no battery. So what does this mean for cells? Well, a lot of things. ATP is needed for pretty much every cellular function. But for those with pyruvate kinase deficiency, the cells that fare the worst are the red blood cells. Recall how red blood cells don't have mitochondria. This means that they rely exclusively on glycolysis for energy. Since pyruvate kinase is one of the major ATP producing steps in glycolysis, you can imagine how a deficiency in this enzyme might be a very bad thing for red blood cells. Speaking of red blood cells, did you notice the wheels of this kiteboard? Yeah, they look red and like eerily red blood cell shaped. Yep, one of these wheels definitely broke apart when the kiteboard crashed. See that shattered wheel below? This broken red wheel should help you remember hemolysis. You see, ATP is needed by red blood cells to maintain their flexibility as they travel through the body and squeeze through capillaries. The exact mechanism isn't so important for us, but you should remember that the lack of ATP in pyruvate kinase deficiency causes these red blood cells to become more rigid. These rigid red blood cells are more prone to being broken down, aka more prone to hemolysis. Now, before we continue, I want to take a brief moment to compare pyruvate kinase deficiency against another disorder of hemolysis, hereditary spherocytosis. Unlike hereditary spherocytosis, pyruvate kinase deficiency will not have a positive osmotic fragility test. To help you remember this, recall how we're in the desert. There's no water here, definitely nothing osmotic going on. Again, expect a negative osmotic fragility test in pyruvate kinase deficiency. Next, I want you to take a look at this pirate's decidedly spleen-shaped bag. This pirate must have taken a few anatomy classes because she's even got it slung over her left side. Conveniently, this spleen-shaped bag helps us remember the spleen, the primary location of hemolysis in the disease. Hemolysis in the spleen by the reticuloendothelial system is also known as extravascular hemolysis, because it doesn't really happen inside blood vessels, but rather only inside the spleen. Our pirate must be the gunner on her ship because she's also decked out to remind us of some of the downstream findings of extravascular hemolysis. She has a belly ring, which you can use to remind yourself of the increased indirect bilirubin, or bilirubin, seen in extravascular hemolysis. But you don't really need a symbol for this. Since red blood cells are undergoing hemolysis, you can imagine how breakdown products might increase. I'm talking about increased indirect bilirubin, which can present as yellow itchy skin, or jaundice, or coalesce into pigmented gallstones in the gallbladder. Because these findings are common in extravascular hemolysis, we didn't really symbolize them here. You should get familiar with this pattern. It will allow you to quickly eliminate many possible causes of anemia. Now let's finally talk about what our kiteboard has crashed into. A big pig. And you know what a big pig reminds me of? That's right, BPG, or 2,3-BPG. Get it? Big pig for BPG? Yeah, I know that's exactly what you think of anytime you see a big pig. Pyruvate kinase deficiency increases levels of 2,3-BPG, and it's high yield to remember that this causes a right shift in the oxygen dissociation curve. This means that affinity of the red blood cells for oxygen decreases, thereby increasing oxygen delivery to the tissues. We've made it easy for you to remember it here, since we've put our big pig on the right side of the image. Yep, it shifts the curve right. Finally, take a look at what our big pig was doing before our kiteboarder had her accident. Yep, it was chomping down on these burrs. These burrs here should help you remember the presence of burr cells on peripheral blood smears. These burr cells are also called echinocytes, which means hedgehog cells. So they are perhaps the cutest of all the red blood cells. But while these are pretty to spot on a smear, if you see burr cells, don't immediately pick pyruvate kinase deficiency as the choice. There are several conditions that can cause the appearance of burr cells, so you need to make sure the rest of your vignette is consistent with the other findings we discussed previously. Now, before we end things here, I want to briefly touch on how you might see pyruvate kinase deficiency on your exam. Most likely, your question will feature a newborn with symptoms of extravascular hemolytic anemia. Once you've recognized that, you will need to differentiate pyruvate kinase deficiency from other causes of extravascular hemolysis. We've talked about how a normal osmotic fragility test can help you know you're dealing with pyruvate kinase deficiency and not hereditary spherocytosis. You might also see a negative Coombs test because there's no autoantibodies against red blood cells here. In addition, the hemolysis will be chronic instead of episodic, which can help you eliminate G6PD deficiency. G6PD deficiency usually presents episodically due to oxidative stress. I also want to mention that the confirmatory test for pyruvate kinase deficiency is a pyruvate kinase activity assay. You're unlikely to see this though because it's so obvious. Next, let's briefly touch on treatment. Odds are you won't be asked about treatment, but before we wrap up, I'll mention it briefly. Splenectomy is used for severe cases, and your patient might need blood transfusions, which can cause iron overload over time. Alright, now that's it. Let's recap quickly and let this pirate get back to her vacation. Pyruvate kinase deficiency is a rare cause of inherited hemolytic anemia. It is caused by defects in pyruvate kinase, which impairs glycolysis and in turn causes ATP depletion. ATP depletion particularly affects red blood cells, which undergo extravascular hemolysis in the spleen. In addition to signs of extravascular hemolysis, patients will have increased levels of 2,3-BPG and will have burr cells on peripheral blood smear. Great! Now we're actually done with pyruvate kinase deficiency. You should go take a vacation too. To the library.